Hey everyone, and welcome to Myth Busting Medicine. I am Dr. Paul, and I'm a family medicine physician. Today, we're talking about something that's been making headlines again: measles. You might think of measles as a disease of the past, something eradicated, a relic. But guess what? It's back in the US, and it's a serious concern. So, what exactly is measles? It's a highly contagious viral infection. We're talking really contagious. How easily does it spread? Well, if an infected person coughs or sneezes, tiny little droplets can linger in the air for up to 2 hours. Imagine walking into a room where someone with measles was. Even if they've left, you can still get sick. And if you touch a contaminated surface and then touch your eyes, nose, or mouth, bingo, you can get measles. So, what does measles look like? It often starts with cold like symptoms: high fever, runny nose, cough, red watery eyes, and then the telltale sign, those little tiny spots inside of your mouth called Koplik spots. A few days later, that distinctive blotchy red-brown rash appears, usually starting in the face and spreading downwards. Now here's the crucial part. Measles isn't just an uncomfortable rash. It can lead to serious life-threatening complications: ear infections, pneumonia, encephalitis, which is an inflammation of the brain that can cause permanent brain damage. For pregnant women, it could lead to pregnancy loss or premature birth. In severe cases, it can lead to death. In fact, in 2025 alone, there have been over 1,100 confirmed cases of measles in the US across 34 jurisdictions, with some cases requiring hospitalization and, sadly, even deaths. The vast majority of these cases were people who were unvaccinated or with unknown vaccination status. This is why vaccinations are so incredibly important. The best defense against measles is the MMR vaccine. That stands for measles, mumps, and rubella. It's safe, effective, and has been protecting people for generations. 2 doses of the MMR vaccine are about 97% effective at preventing measles, providing long-term immunity. The first vaccine is typically given about 12 to 15 months. The second one at 4 to 6 years. These recommended ages are key for building strong immunity. You might be thinking, but aren't there side effects? Like any vaccine, there can be mild side effects, such as fever or a mild rash. Serious reactions are extremely rare. And for those persistent myths linking the MMR vaccine to autism, let's be crystal clear. Numerous, extensive scientific studies have definitively shown no link between the MMR vaccine and autism. The safety and effectiveness of the MMR vaccine have been thoroughly studied and proven. When vaccine rates drop, measles case rises. It's that simple. We've seen it happen in communities where vaccination rates have fallen below the crucial 95% threshold needed for herd immunity. Herd immunity is vital. It means that there are enough people in the community who are vaccinated. It protects those who can't be vaccinated, like infants too young to receive a vaccine, or individuals with compromised immune systems due to a medical condition. They rely on us. So what can we do? Check your vaccination records. Ensure your children are up to date with their MMR shots. If you're unsure about your own status, talk to your doctor. Your doctor will be able to check through blood work to see if you are immune or not. Share accurate information about vaccines with friends and family, and that is crucial. The more people who speak the truth, the more people will get vaccinated. The more people will be protected against measles. Measles is a preventable disease. By getting vaccinated, you're not just protecting yourself, you're protecting your family, your neighbors, and your community. Let's work together to keep measles out of the US and ensure a healthier future for everybody. Thank you for watching. I hope you enjoyed. If you want more content, please subscribe and like, and I'll see you next time.